My name is Juan Sanchez. I'm 36 years old, and I start feeling tingling and numbness on my left side. I mean, as a guy, I always try to skip go to the doctor, so I always was like, just one day I gotta go.
Yeah, Mr. Sanchez came to see us with the complaints of this numbness and tingling in his left leg, and it had traveled all the way up to his left arm. And these symptoms weren't so significant at that time. He just thought, maybe my leg is falling asleep, but never thought when he got the imaging what it really showed.
They sent me to do an MRI. I did the 2 MRIs, neck and back, and then a week later I came back.
That's where we came along and had this serious conversation that there was a spinal tumor within the middle of your spinal cord, in the middle of your neck. How can you express this to somebody without making them feel overwhelmed?
Of course, you start feeling sick, start getting like you can't even stand up, you feel like your knees are getting weak. And but now that I think about it, it's just maybe the way he said it to me. He didn't put any drama on it. He just said, it's a tumor. Everything's gonna be fine. We don't know what kind of tumor it is until we open, but you're in good hands. You're gonna be fine. And it is hard to believe, but I walk out of that office that day a little bit afraid. There's a lot of emotions. There's a mix of emotions. Of course, the scare was the main one, but at the same time, I feel that I was in good hands since the beginning because the way he told me that.
We're honest. We like to, tell the patients up front so that we're a team. As much as my brother and I are brothers, we like to think of them as family so that we're all together and that no matter what happens, we did our best to know that you're aware, that we want you to be fully informed. So when you go after surgery, that we did this all together.
In a broader picture of UF Health Department of Neurosurgery, we carry that same principles across all the disciplines in neurosurgery. So we take care of patients with brain tumors, vascular problems, as well as movement disorders such as Parkinson's, as well as neurotrauma. But there is a common theme, and that is that all the faculty members have a philosophy of collaboration. We have case review conferences to discuss cases, and not one surgeon feels that they have to do things by themselves.
And they say they couldn't tell me what kind of tumor it was until they opened. But it was a big chance that I probably won't be able to walk after the surgery or not able to move my completely left side. Dr. Stobanopoulos' brother, he talked last and he says, what I can tell you is if you say no, I will respect you. You walk out of here because you know what you're thinking. I'm walking right now, unable to work, and now you want me to walk in the hospital, and I don't know how I'm gonna go out. And I understand that part. The problem is already you have a tumor in there. We don't know for how long, you don't know how big it's gonna get or how worse it's gonna get the situation. So if it happens that in a year later, you call me and says, doctor, I can't move my leg. Something happened. I will bring you in, I will do surgery, but I can't fix what is already done.
And the other part too is that the tumor was inside the spinal cord. So you have to enter the spine, the cord itself, to get to the tumor, and that has more risk versus some tumors that are next to or outside the actual spinal cord.
Every little millimeter difference can change this patient dramatically, and we pushed our limits when things looked like maybe we had to stop because it was difficult. We persevered and kept going and gave Mr. Sanchez a wonderful result of taking the tumor all out.
It was a great surgery. It was 11 hours of hard work between his and his brother, and I feel that I was a lucky person going through a bad situation, but with the best team next to them.
We're so proud and happy for Mr. Sanchez's results. And though he had a spine tumor, that's not what we just take care of. We take care of a comprehensive of problems at UF Health at our Comprehensive Spine Center. You have neck pain, you got back pain shooting down your arms and legs and thinking this is your life. It may not be true. We're maybe here for you to take care of, and that something that you never thought could ever be cured, it could be taken care of by us at the UF Health Comprehensive Spine Center.